Thank you for joining us virtually today. I'm very pleased to be joined by three of our specialists across the world. Firstly, Dr. Irene Lai, Dr. Greg Jakubowski from Singapore, and Dr. Mark Parrish from London. Today, we hope to cover two key areas that are really part of the agenda in today's management decision making. They are the return to operations and return to office environment, and how do you do that safely? And secondly, the review of the approach relative to the return to a travel environment, whether that's domestic or international, and how that is evolving aligned with the pandemic curve in your area. Before we do that, though, I'd firstly like to pass over to Dr. Mark Parrish for him to take us through the current past week view in terms of COVID-19. Dr. Mark, over to you.
Thanks, Greg. Thanks, Mike, and hello all. Yes, a good week in the last week, I would say. I mean, don't pay too much attention to the figures that are published on many websites with 6 million cases and 370,000 deaths. Those are wildly inaccurate and rely upon the amount of testing that you're doing and how you measure deaths, which different countries do. But let's just think of what we've seen. We've seen, as you said, Mike, a gradual movement to this return to operations. Wrapped around that, we've got some better testing coming out now. Certainly the antibody testing availability is now very accurate. So now it's all a case of, as we return to the office, how do we pull all these things together? How do we get our staff back to work, whether you are in an office, whether you are in a factory or some other workplace? We see organizations that run predominantly office-based businesses often making decisions not to reopen those offices at the moment, sometimes waiting until the new year. For factories and other workplaces, well, they've probably been continuing to work at some level during the outbreak, and now they are ramping up. And then for retail stores, it's how do you make those safe and get your business back to normal? And I think we're going to see a lot more of that in the next few weeks, Michael, and that's going to be the main focus, as well as this return to travel.
Lovely. Thanks very much, Dr. Mark. As we see de-escalations happening, and as you mentioned, we're seeing different phases of this wave in different parts of the world. Clearly, our clients and members are experiencing this at a different point in time. I'd like to go across to our panel of experts now and just draw on your experience in supporting organizations in what this is as a new norm of today's world. And the first question I'd like to position to you is, what has been the main challenges that we've seen organizations face to ensure a safe return to operations, and whether that's back to an office or an operation, or whether it's back to a factory or a retail outlet or even an oil rig? And perhaps I can go to Dr. Irene in Sydney first, just for some of those high-level challenges that you're seeing, Irene.
So in Australia, we're actually very well placed at the moment, and today being June 1, we've seen some restrictions being lifted. From state to state, the restrictions are lifting slightly differently. We've generally speaking got a very low rate of virus activity nationally. There are a few places that haven't reported cases for quite a few days, and the majority of cases are still imported. They're imported, so Australians who've come back and they're actually still in quarantine. We have a few clusters here related to a work environment. So one is in a meat packing facility, and there's also a cluster in Western Australia related to a live export ship. But there are a number of places in the Asia Pacific area that also have very low levels of transmission. New Zealand, of course, being one of them. New Zealand's gone 10 days now since its last confirmed or probable case has been reported. So organisationally, we're considering, how do we go back to the office? How do we go back to having groups of people meeting together? And part of the challenge has been, number one, is how do we get to where we're going? Public transport, are we using private transport? And if we're using public transport, how do we avoid that time of day when there are likely to be more people traveling? If we can we keep that safer distance of 1.5 meters, 2 meters from other people? And if we can't keep that distance between us, how do we keep people safe for that time that they're commuting. And then, you know, part of the challenges have been when you get to a facility where you congregate, how do you get to your office? So, you know, within the office, you may have that 2 meters of space between each employee, but you need to get together, for example, to go into a lift. And particularly in the urban centers, you know, you've got hundreds of people going into these buildings that have X number of space in a lift. And the initial guidance that came out was, you know, you need to keep 1.5 meters between people. And so realistically speaking, it meant in these elevators, you had 2 people. So we had these huge bottlenecks. So people are working around that. Safe Work Australia, for example, has changed its guidelines somewhat. And in Australia, we're talking about when to use a mask. The general guidance is with low levels of transmissions, face masks don't need to be used. They don't help very much and may create a false sense of security. However, certain people may want to wear them in certain circumstances. And so operationally, the challenges have been the transport. How do we get to work? How do we maintain that distancing? Some offices have had that distancing in place for some time. Others are facing that challenge for the first time. And I do think it's a matter of assessing the risk for not only for the organisation as a whole, but for each role, and particularly for people who are in customer-facing roles where they meet numbers of the general public, so they're not just working with their colleagues, but they see members of the public and might be quite a number of different people through the course of a day. How do you keep those employees safe?
Lovely. Thanks very much, Dr. Irene. Dr. Greg, if we can turn to you now in Singapore, what's the experience that you've seen with some of the clients in Singapore, and maybe some more detail about how that's being emanated?
Thanks, Mike. So I do sit in Singapore, but I support a lot of multinational corporations across Asia. And I've had the privilege of speaking to one, a very well-known multinational corporation, and their main challenge is how to bring a large number of employees onto site. And we're talking about massive sites in the tens of thousands of employees. These are R&D sites, call centers, manufacturing facilities, or what we call BPOs, business process outsourcing. And this client wanted to find out how to prepare their employees and themselves and divide it into 3 phases. The first phase is screening the employees before they arrive on site, the planning phase. And of course, they want them screened for maybe an exposure that puts them at risk for having COVID, maybe for underlying illnesses or what we call morbidities. But they wanted to go a little bit further. They wanted to screen for elderly mothers and fathers, uncles and aunties, because in Asia, there's still this concept of a nuclear family and a lot of different generations are living together. And these employees might be fine if they caught COVID, but their at-risk elderly family members could actually succumb to the illness. And then they wanted to know how to potentially do confirmation of the questionnaire, which they wanted electronically to be done through a link or an app, just a confirmation through teleconsultation. Second phase, on the day of the return, they wanted to minimize the exposure of these employees to, even though they have been screened, being exposed to a COVID patient in transportation modalities that are quite crowded, the jeepneys in Philippines, the microbuses in India, where they spend up to 2 hours going back and forth between their home and the site. And, you know, once they arrive on site, there's of course the temperature screening, but they also wanted a physical examination, someone to lay hands on an employee just to keep them truthful to whatever it is that they answered on the questionnaire. And some actually wanted to implement the little bit controversial issue of rapid diagnostic tests just to create the right optics in front of government and public health officials that they did everything they could. And then the third phase is the new normal, maintenance of the new normal. How do you keep the momentum for employees, floor managers, plant managers to have physical barriers to allow the social distancing, and also how to prepare for that second wave, which a lot of the companies I speak to are saying is a matter of if, not a matter of when. How do you prepare for the hot case, the employee who pops their head around the doorframe and says, "Boss, I've got a fever and I don't feel well." How do you quickly isolate this individual in a designated room? who assists them and how are they properly covered with personal protective equipment? Are there on-site directives as to which facility they should go to? What communication you send out to external government stakeholders as well as internal scared employees? And then how do you clean and disinfect the facility so you can take out your team A and bring in your team B? So a three-phased approach to thinking about how to return to operations. Back to you, Mike.
Excellent. Thanks, Dr. Greg. And going to Dr. Mark in London. Mark, can you perhaps summarize then, really from a client member point of view, what are the key areas that they need to focus on as they approach this return to operations environment?
Yeah, maybe we can do that pulling what Irene and Greg have said just now, because they actually gave a couple of really good examples of what we are seeing for organizations, globally, and certainly I remember talking to quite a few in the last week or so. I put it in three, really. One, do you have a plan? And is your plan capable of dealing with the vast number of differences that different countries are pushing out? So if you're going to Cyprus at the moment, you need to have had a PCR viral test within 3 days of arriving in Cyprus. That's from getting on the plane. Why? I don't know, but you do. And so can you help there? So we're helping organizations do that. So you need that plan. Then you need to think of all of the options of how you're going to make your workplace safe and make sure it is safe, whether it's an office, whether it's a factory, whether it's a retail store. We're doing lots of walkarounds of these places just to give organizations some thoughts. And remember that piecemeal approach to how you try to stop COVID. So wearing masks is not the simple answer. Don't be fooled by thinking if I wear a mask, I'm okay. Remember, it's layers. You've got to have all of those layers in place. And then the third bit of this, which we are now starting to see, and I think we'll see more of in the next month or so, is as well as returning to operations, how do you return to travel? How do you work with your workforce, the airline industry that you want to try to get people back onto, and then those governments and different border screening arrangements to try to get people moving around again? I think that's what we'll continue to see, and that's what we're certainly doing a lot of work on at the moment, Mike.
Thank you very much, Dr. Mark. And that leads us perfectly into the next part of the session today, is looking at that international travel. So if we do, I mean, perhaps more about the engagement and navigation for clients and members to undertake, but not only international travel, domestic travel. And we can clearly see that across the world, we're seeing bubbles developing of what might be considered more safer travel, or an allocation between countries where there is agreement at government level to allow inter-travel between those countries where they've established guidelines accordingly. As the experts on the panel, what would your guidance be as a best practice for organizations when they're considering, the if and when they allow their staff to restart that travel agenda? And perhaps again, let's go to Dr. Irene first and have a look at the situation across Australasia and perhaps some of those other examples that you've seen, Irene.
So, firstly, it's a matter of whether the travel is feasible. What are the restrictions in place, and what is the support available at the destination? So is the border open is one question. Is there a flight to get there? Then, of course, if you do get there, depending on where you've come from, what are the restrictions on you? Does it mean that you've got to be quarantined for 14 days in a particular location, whether that's government mandated or it's a recommendation, etc. And so then the other consideration is, okay, at your destination, if you were to get sick, what sort of support could you be given there? And particularly, for the majority in Australia, for example, if you were to have a respiratory illness at the moment, it's most likely it's not going to be coronavirus. But what sort of restrictions would be placed on you as a traveller? And we've seen some travellers who, depending on where they're going, can't get routine care done, particularly face-to-face. So telehealth may be possible, but face-to-face can be very challenging, even for garden variety illnesses that are not COVID. There are certain countries that are in discussions now for a travel bubble, a safe corridors, and that's where governments see that that particular location has a lower risk of somebody arriving from that place potentially having a COVID exposure, and therefore being able to relax that 14-day quarantine period. So that hasn't actually eventuated yet. We don't even have that within the States yet, but that's where talks are going. So I would say, in terms of looking at your travelers, number one is, where are you going? Keep an eye on the information. It's changing all the time. Stratify your type of travel. Is it essential? How essential is it? And what time frame do you need to have it done by? Do you need to have it done in the near time frame, or could it be something that could be delayed? Thanks, Mike.
Thanks, Dr. Irene. Let's go secondly to Dr. Greg, because Dr. Greg, you've had a lot of experience dealing with clients who have been arranging travel, especially across the Asia environment. Can you give our members and clients some visibility about some of those challenges, what you've been experiencing, and how you've been approaching solutions with those clients?
Thanks, Mike. Spot on. I have been speaking to quite a few organizations, and many of these MNCs have production facilities in countries that are either self-owned or run by third-party providers, and they have no choice. They have to bring high-level stakeholders, sometimes senior engineers, into Asia, into countries like Vietnam, like China, from Europe and the US, but to a large degree from other countries in Asia Pac, like Singapore, like Malaysia and South Korea. And they face an issue of when to do this and how to do this. And I'm not going to spend a lot of time on the when, because that's for their management and the crisis management teams to decide. But sometimes what they need is looking at projection curves to see whether the cases are decreasing. We use a 5-day moving average to show that if it's less than a certain percentage over a certain amount of time, there's containment. But also they need to see if the country where they're going is ready for what Dr. Irene very well outlined, for taking care of a non-COVID related illness, if that were to happen. Now, if we talk about the how, I had the privilege of supporting a large multinational corporation having to bring in individuals into 2 countries in Asia Pac. And the first thing that needed to be done is the screening for the travel. There had to be an arrangement of carrying out physical exams to make sure they were fit to travel, so they didn't have a non-COVID related emergency, or you minimize the chance of that as much as possible when they were in Vietnam, in China. But also they needed to undergo COVID testing, because the airline, which by the way, they chartered a plane, was not going to let the individuals on site. How do you do this COVID testing? Where do you do it? How quickly can you do it? Is it going to be translated to English? That's a challenge we faced, actually. And will they get the VIP treatment which they deserve and expect? Once they land, that second phase, at a crowded hospital in airport in Ho Chi Minh City, in Hanoi, how do they navigate the repeat questionnaires, which are often not in English? How do they then manage their anxiety when they're moved to government quarantine facilities? The employer often doesn't have a choice in these countries to pick the 5-star hotel. And what about simple things like, are they going to have connection to the internet? How often will the sheets be changed? The individuals who come to check on them once a day, twice a week, will they speak English? How do they communicate? Having some kind of a health advocate that helps them navigate that is key. Now they're out of quarantine, the third phase. They're now ready to do what they came into this country to do in the first place, but now they're moving around the country quite often to non-urban rural areas. What happens if they have a non-COVID related emergency? Where do they go? Which are the facilities that are not constrained by either COVID cases or are closed off to non-COVID cases? Can we use private facilities where the authorized person is able to get more information? And then in the worst case scenario, what if they develop a fever and they're not feeling well? Having again that health advocacy to be able to redirect them to maybe a private facility that can at least send off a sample for the test, assess them. Maybe they just have a simple cold, because as Dr. Irene said, not all fevers in Australia are COVID cases. And then what happens if they do have a COVID, the illness? If they get admitted to a public healthcare facility, who communicates with the treating medical officer who might not speak English? How do they are reassured in terms of how long they're going to be there, and are they being treated appropriately? How are their family members being reassured? And again, the comfort measures. Are they going to have that duvet? Are they going to have that clean pillow? Are they going to be able to get that food? So it's a complex approach that focuses on a response to a medical issue, but also to the comfort, everyday kind of issues review that they will be facing when they go to these countries. Back to you, Mike.
Yeah, very clear, Dr. Greg. Thank you. And it demonstrates really the importance of pre-planning and preparation ahead of these adventures, and understanding that it is not just about travel anymore. There are considerably, as you say, complex layers that need to be considered prior to starting to make that movement. So moving across to Dr. Mark in London, finally then. Dr. Mark, in terms of the sort of overall, the summary, the position clients relative to being ready to make the decision that they have prepared the environment safely for their workforce, how do you advise them on that?
It goes back to having a plan and being aware of different country regulations, because they will change all the time. But I think one of the other things that we are seeing, and this was brought up by Irene and by Greg, is let's not forget, let's not have just too much, how would I say this, COVID myopia. Other healthcare issues have not gone away. And depending what you're doing, where you're doing it, how you're doing it, and for how long you're doing it, you may well actually have a greater risk from some other healthcare threat than from COVID itself. So be aware of that. And then the third thing, and we all seem to talk in threes, don't we? The third thing is, like, don't forget about those long-term effects of COVID. And that's not just the pure physical health ones. I'm always thinking about the mental health aspects and the mental health of fallout from COVID. I think that's going to go on for a long time. So let's make sure that organizations have got ways of planning and dealing with that now.
Lovely. Dr. Mark, thank you very much. To everybody out there, thanks very much for joining our weekly session today. Again, another thanks to our panel of specialists for sharing their insights. And to all of you, I do hope that you'll be able to join us next week's session. If you wish to have any further information regarding COVID-19, regarding Prepare Your Business, do have a look at our website. The details will be posted on the banner below. So thanks very much for joining us today. Do take care, and we'll see you all next week. Thank you.